Hello friends, we are once again welcome to Join Academy. In this video we will be looking at the muscles of the forearm. The forearm is the region of the upper limb between the elbow joint and wrist, and it is divided into anterior and posterior compartments. These compartments have different muscles which we will look at, so let us relax and enjoy the sweet savor of the forearm anatomy. Like we stated, the forearm is divided into an anterior and posterior compartment. We will first of all look at the muscles of the anterior compartment. The muscles of the anterior compartment of the forearm are generally regarded as the flexor muscles. They are divided into three layers of muscles. They are the superficial, intermediate, and deep layers. Let us take these layers one after the other. We will start with the superficial layer. The muscles of the superficial layer are the flexor carpi ulnaris, palmaris longus, flexor carpi radialis, and pronator teres. They all originate from a common tendon which arises from the medial epicondyle of the humerus. The flexor carpi ulnaris has two origins, the humeral head and the ulnar head. The humeral head originates from the medial epicondyle of the humerus, along with other superficial flexors, while the ulnar head originates from the olecranon of the ulna. As for the insertion of this muscle, the tendon of the muscle passes into the wrist and then inserts at the pisiform bone, hook of hamate and base of the fifth metacarpal. The action of this muscle is the flexion and adduction at the wrist. This muscle is innervated by the ulnar nerve. Palmaris longus is another muscle of the superficial layer that is absent in about 15% of the population. It originates from the medial epicondyle and inserts at the flexor retinaculum of the wrist. The function of this muscle is the flexion at the wrist, and it is innervated by the median nerve. Flexor carpi radialis originates from the medial epicondyle and attaches at the base of metacarpal 1 and 2. Actions performed by this muscle is flexion and abduction at the wrist, and the nerve supply is by the median nerve. The pronator teres is the muscle that forms the medial borders of the cubital fossa. It has two origins, one from the medial epicondyle and the other from the coronoid process of the ulna. It attaches laterally to the midshaft of the radius. The function of this muscle is the pronation of the forearm, and it is innervated by the median nerve. The intermediate compartment contains only one muscle called the flexor digitorum superficialis. It can sometimes be classified as a superficial muscle, but in most individuals it lies between the deep and superficial muscle layers. The muscle is a good anatomical landmark in the forearm. The median nerve and ulnar artery pass between its two heads and then travel posteriorly. As for the attachments of this muscle, it has two heads. One originates from the medial epicondyle of the humerus, the other from the radius. The muscle splits into four tendons at the wrist, which travel through the carpal tunnel and attach to the base of the middle phalanx of the four digits. Actions of this muscle consist of the flexion of the metacarpophalangeal joints and also proximal interphalangeal joints at the four fingers. It also causes flexion at the wrist. This muscle is innervated by the median nerve. The deep compartment contains three muscles. They are flexor digitorum profundus, flexor pollicis longus, and pronator quadratus. Flexor digitorum profundus originates from the ulnar and associated interosseous membrane. At the wrist, it splits into four tendons that pass through the carpal tunnel and attach to the distal phalanges of the four fingers. The function of this muscle is that it flexes the distal interphalangeal joints of the fingers, and it is the only muscle that can flex the distal interphalangeal joints at the fingers. It also flexes at metacarpophalangeal joints and also the wrist. The nerve supply of this muscle is from two sources. The medial half of the nerve, which acts on the little and ring fingers, is innervated by the ulnar nerve. The lateral half, which acts on the middle and index fingers, is innervated by the anterior interosseous branch of the median nerve. The flexor pollicis longus lies laterally to the flexor digitorum profundus. It originates from the anterior surface of the radius and surrounding interosseous membrane and attaches to the base of the distal phalanx of the thumb. The function of this muscle is that it flexes the interphalangeal joint and metacarpophalangeal joint of the thumb. The nerve supply to this muscle is by the median nerve, anterior interosseous branch, and the last muscle of the anterior compartment of the forearm, which is the pronator quadratus, is a square-shaped muscle found deep to the tendons of the flexor digitorum profundus and flexor pollicis longus. It originates from the anterior surface of the ulna and attaches to the anterior surface of the radius. The action of this muscle is that it pronates the forearm, and the nerve supply to this nerve is by the median nerve, the anterior interosseous branch. As we have been able to see the different muscles of the anterior compartment of the forearm, let us also look at the muscles of posterior compartment of the forearm. The muscles in the posterior compartment of the forearm are commonly known as the extensor muscles, because their general function is to produce extension at the wrist and fingers. They are all innervated by the radial nerve. Unlike the muscles of the anterior compartment that are grouped into 3 layers, the muscles in this compartment are organized into 2 layers, which are the deep layer and the superficial layer. These 2 layers are separated by a layer of fascia. The superficial layer of the posterior forearm contains 7 muscles. 4 of these muscles, which are extensor carpi radialis brevis, extensor digitorum, extensor carpi ulnaris, and extensor digiti minimi, all share a common tendinous origin at the lateral epicondyle. Like we stated that all muscles in the posterior compartment of the forearm are all extensor, there is an exemption to this. The brachioradialis, which is also located on the posterior compartment of the forearm and also possesses the characteristics of an extensor muscle, is a flexor at the elbow. When this muscle can be clearly seen is when the forearm is pronated and flexing at the elbow against resistance. The muscle is most visible when the forearm is half pronated and flexing at the elbow against resistance. In the distal forearm, the radial artery and nerve are sandwiched between the brachioradialis and the deep flexor muscles. The muscle originates from the proximal aspect of the lateral supracondylar ridge of the humerus and attaches to the distal end of the radius just before the radial styloid process. Just as we stated, this muscle performs flexion. It flexes at the elbow. It also contributes to supination at the proximal radio-ulnar joint. This muscle is innervated by the radial nerve. The extensor carpi radialis muscles, that is both the longus and brevis, are situated on the lateral aspect of the posterior forearm. Due to their position, they are able to produce abduction as well as extension at the wrist. Extensor carpi radialis longus originates from the lateral supracondylar ridge of the humerus, while the extensor carpi radialis brevis originates from the lateral epicondyle. Their tendons attach to metacarpal bones 2 and 3. Their actions are that they extend and abduct the wrist. They are both supplied by the radial nerve. The extensor digitorum is the main extensor of the fingers. To test the function of this muscle, the forearm is pronated and the fingers extended against resistance. It originates from the lateral epicondyle. The tendon continues into the distal part of the forearm, where it splits into 4 and inserts into the extensor hood of each finger. The action of this muscle is the extension of the digits at the interphalangeal and metacarpophalangeal joints. It is innervated by the deep branch of the radial nerve. The extensor digiti minimi is thought to originate from the extensor digitorum muscle. In some people, these 2 muscles are fused together. It lies medially to the extensor digitorum. It originates from the lateral epicondyle of the humerus and attaches, with the extensor digitorum tendon, into the extensor hood of the little finger. The action is that it extends the little finger and contributes to extension at the wrist. It is also innervated by the deep branch of the radial nerve. The extensor carpi ulnaris is located on the medial aspect of the posterior forearm. Due to its position, it is able to produce adduction as well as extension at the wrist. It originates from the lateral epicondyle of the humerus and attaches to the base of the 5th metacarpal. The action is the extension and adduction of the wrist. This muscle is also innervated by the deep branch of the radial nerve. The anconeus is situated medially and proximally in the extensor compartment of the forearm. It is blended with the fibers of the triceps brachii, and the 2 muscles can be difficult to differentiate. It originates from the lateral epicondyle and attaches to the posterior and lateral parts of the olecranon. The actions consist of the extension and stabilizing of the elbow joint. It also abducts the ulna during pronation of the forearm. This muscle is also innervated by the radial nerve. Let us have a look at the deep muscles. There are 5 muscles in the deep compartment of the posterior forearm. They are the supinator, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor indicis. With the exception of the supinator, these muscles act on the thumb and the index finger. The supinator lies on the floor of the cubital fossa. It has 2 heads, which the deep branch of the radial nerve passes between. One of the heads originates from the lateral epicondyle of the humerus, and the other from the posterior surface of the ulna. They insert together into the posterior surface of the radius. The action of this muscle is to supinate the forearm. It is innervated by the deep branch of the radial nerve. The abductor pollicis longus is situated immediately distal to the supinator muscle. In the hand, its tendon contributes to the lateral border of the anatomical snuff box. It originates from the interosseous membrane and the adjacent posterior surfaces of the radius and ulna. It then attaches to the lateral side of the base of the metacarpal one. It abducts the thumb. The posterior interosseous branch of the radial nerve innervates this muscle. The extensor pollicis brevis can be found medially and deep to the abductor pollicis longus. In the hand, its tendon contributes to the lateral border of the anatomical snuff box. It originates from the posterior surface of the radius and interosseous membrane. It attaches to the base of the proximal phalanx of the thumb. It extends at the metacarpophalangeal and carpometacarpal joints of the thumb. It is also supplied by the posterior interosseous branch of the radial nerve. The extensor pollicis longus muscle has a larger muscle belly than the extensor pollicis brevis. Its tendon travels medially to the dorsal tubercle at the wrist, using the tubercle as a pulley to increase the force exerted. The tendon of the extensor pollicis longus forms the medial border of the anatomical snuff box in the hand. It originates from the posterior surface of the ulna and interosseous membrane. It attaches to the distal phalanx of the thumb. The action is that it extends all joints of the thumb, which are carpometacarpal, metacarpophalangeal and interphalangeal. The nerve supply is the same with that extensor pollicis brevis. The extensor indicis proprius allows the index finger to be independent of the other fingers during extension. It originates from the posterior surface of the ulnar and interosseous membrane, distal to the extensor pollicis longus, and then attaches to the extensor hood of the index finger. Action is that it extends the index finger. The nerve supply is still the same posterior interosseous branch of radial nerve. The clinical relevance of these muscles is wrist drop and lateral epicondylitis. A wrist drop is a sign of radial nerve injury that has occurred proximal to the elbow. There are 2 areas where the radial nerve is at high risk of damage. The first is at the axilla. The radial nerve can be injured through humeral dislocations or fractures of the proximal humerus. The next area of possible damage is the radial groove of the humerus. The radial nerve can be injured through a humeral shaft fracture. The radial nerve innervates all muscles in the extensor compartment of the forearm. In the event of a radial nerve lesion, these muscles are paralyzed. The muscles that flex the wrist are innervated by the median nerve and therefore are unaffected. The tone of the flexor muscles and gravity produce unopposed flexion at the wrist joint. Lateral epicondylitis, which is also known as tennis elbow, refers to inflammation of the periosteum of the lateral epicondyle. The peak age of onset is 40 to 50 years old. It is caused by repeated use of the superficial extensor muscles, which strains their common tendinous attachment to the lateral epicondyle. Alright guys, that is it on the muscles of the forearm. I hope you found this video. Support Joan Academy with a like and share. Don't forget to subscribe and also leave a comment. Expect more from Joan Academy.